Have you ever felt a sudden wobble when standing up? Or a strange dizziness that came out of nowhere? You're not alone, and it's not just getting older. It could be a warning sign your body is desperately trying to tell you, after 60, losing your balance isn't just a minor inconvenience. It's one of the biggest predictors of serious injuries, hospitalizations, and even loss of independence. In today's video, we're uncovering the 13 hidden reasons why your balance starts to fade, and trust me, number 7 will completely shock you. More importantly, we'll show you simple solutions you can start today to regain control, stay strong, and live life on your terms. If you or someone you love is over 60, you can't afford to miss this. Let's get started. 1. Age-related muscle weakness. As we age, one of the most significant changes our body undergoes is the gradual weakening of muscles. After 60, the body's ability to maintain muscle mass diminishes due to a natural process called sarcopenia. Sarcopenia can start as early as the 30s, but it accelerates after 60, leading to reduced strength, decreased endurance, and a higher risk of losing balance. The muscles responsible for maintaining posture, such as those in the legs, hips, and core, become less efficient. This weakness means that everyday activities like walking, climbing stairs, or even standing up from a chair can become challenging, resulting in instability and an increased likelihood of falls. Moreover, with age, not only the size but also the quality of the muscles deteriorates. The fibers that control quick reactions, critical for correcting a stumble or sudden imbalance, are especially affected. When these muscles weaken, the body's reaction time slows, and recovering from minor trips or slips becomes harder. Activities that once seemed effortless require more concentration and strength, and the margin for error shrinks dramatically. Without proactive strength training and balance exercises, seniors may find themselves becoming more sedentary, which, ironically, accelerates muscle loss even further. Strength training, even light to moderate resistance exercises, has been shown to dramatically reduce this muscle deterioration. Engaging in targeted exercises that focus on the lower body and core can rebuild strength, improve stability, and slow the effects of sarcopenia. Programs like Tai Chi, Pilates, and gentle yoga are particularly effective because they enhance both muscle power and balance. It's crucial for seniors to recognize that muscle weakness isn't just an inevitable part of aging, it's something that can be managed, delayed, and even reversed to some extent with the right lifestyle choices. 2. Poor vision. Vision plays a crucial role in maintaining balance, often more than people realize. Our eyes help us determine where our body is in space, guiding movements and correcting missteps. After the age of 60, however, many people experience significant changes in vision, including issues like cataracts, glaucoma, macular degeneration, and reduced depth perception. These changes can severely impact balance because the brain receives less accurate information about the environment. When vision is blurry or distorted, it becomes harder to judge distances, avoid obstacles, and anticipate changes in terrain, making falls much more likely. Additionally, low light conditions can exacerbate vision-related balance issues. Nighttime trips to the bathroom, walking in dimly lit hallways, or moving around unfamiliar spaces can become hazardous. Seniors may also experience slower adaptation to changes in lighting, for instance, moving from a bright room to a darker one, which increases the chance of missteps. Compounding the problem is the reduced contrast sensitivity that often accompanies aging vision problems. Distinguishing between a step and a shadow or identifying a curve becomes difficult, setting the stage for trips and falls. Routine eye exams are essential after 60, not just for preserving vision but also for maintaining balance. Corrective lenses, improved lighting at home, and low vision rehabilitation therapies can all help compensate for declining eyesight. Some seniors benefit from occupational therapy focused on safe navigation, while others might need home modifications like contrasting floor colors or tactile indicators near steps. Addressing vision loss proactively is a key pillar in preserving independence and reducing fall risk for seniors. 3. Inner ear problems. Vestibular disorders. The inner ear houses the vestibular system, a tiny yet critical network responsible for sensing motion, head position, and spatial orientation. After 60, issues like benign paroxysmal positional vertigo, BPPV, Meniere's disease, or general vestibular degeneration become more common. These conditions interfere with the brain's ability to process signals about balance and movement, resulting in dizziness, vertigo, and a sensation of spinning. Such feelings can come on suddenly and unpredictably, leaving seniors disoriented and at high risk of falling. Vestibular problems are often difficult to diagnose because symptoms can be intermittent and resemble other conditions, such as dehydration or medication side effects. Seniors experiencing frequent dizziness may also start avoiding movement altogether out of fear, leading to deconditioning of the muscles and worsening balance. Even mild disruptions in the vestibular system can profoundly affect walking, turning, and getting up from lying down. In some cases, seniors might also experience nausea, blurred vision, or the sensation that the ground is tilting, which only heightens instability. Fortunately, treatments for vestibular disorders are available and often effective. Vestibular rehabilitation therapy, VRT, uses specific exercises to help retrain the brain and body to manage balance more effectively. These exercises gradually challenge the body's balance systems and reduce dizziness over time. Early intervention is key. If you notice persistent dizziness or balance issues, consult a specialist promptly. By addressing inner ear problems, seniors can regain confidence, move more freely, and significantly lower their fall risk. For neuropathy, nerve damage, peripheral neuropathy, a condition where the nerves outside the brain and spinal cord are damaged, becomes increasingly common after age 60. It is often associated with diabetes but can also result from other factors like vitamin deficiencies, particularly B12, infections, or even side effects of certain medications. When nerves in the feet and legs are impaired, they cannot properly transmit signals to the brain about where the body is in space. This miscommunication can cause numbness, tingling, weakness, and most critically, loss of proprioception, the sense of body position, which directly impacts balance. Seniors suffering from neuropathy might not feel their feet touching the ground properly, making every step a guess rather than a certainty. They may shuffle, move cautiously, or avoid walking altogether. Such compensations actually increase the risk of imbalance and falling. Furthermore, neuropathy can cause sharp pain, burning sensations, or sudden jabs, which can unpredictably disrupt concentration while moving. Even when seated, a sudden shooting pain can cause a shift in posture and increase the likelihood of a fall. Management of neuropathy focuses on treating the underlying cause, managing symptoms, and adopting supportive strategies. Regular foot exams, physical therapy to enhance strength and flexibility, and the use of assistive devices like canes or walkers can help. Wearing shoes with proper support, ensuring safe walking environments, and balancing exercises can also improve mobility. Recognizing the early signs of neuropathy and taking action can prevent the progression of balance problems and preserve overall mobility and independence. 5. Medications and their side effects. As people age, it's common for them to be prescribed multiple medications for chronic conditions such as high blood pressure, diabetes, arthritis, or heart disease. However, many of these medications have side effects that can interfere with balance. Drugs like sedatives, antidepressants, antihypertensives, and even some painkillers can cause dizziness, drowsiness, blurred vision, muscle weakness, and low blood pressure upon standing, orthostatic hypotension. These side effects can make seniors feel unsteady on their feet and increase the risk of falls, particularly when getting out of bed or rising from a seated position. Another major issue is the interaction between multiple medications, a phenomenon known as polypharmacy. When several medications are taken together, they can amplify each other's side effects, even if each drug alone would not significantly affect balance. For example, combining a blood pressure medication with a sedative might dramatically lower blood pressure and cause extreme dizziness. Seniors are also more sensitive to medications because of age-related changes in metabolism and kidney function, which means drugs stay in the system longer and can have stronger effects. As a result, something as simple as standing up quickly or turning too fast can lead to a dangerous fall. To minimize medication-related balance problems, it's important for seniors to have regular medication reviews with their healthcare providers. Doctors or pharmacists can identify high-risk medications and suggest alternatives or adjustments. Sometimes, a simple change in dosage, timing, or the type of medication can greatly improve stability. Seniors should also be encouraged to rise slowly from sitting or lying down, stay hydrated, and report any new symptoms like dizziness or confusion to their doctors promptly. 6. Dehydration. Dehydration might seem like a minor issue, but for seniors, it can have serious consequences, including balance problems. As we age, our sense of thirst diminishes, meaning older adults often don't realize when they're becoming dehydrated. Dehydration reduces blood volume, leading to low blood pressure, dizziness, lightheadedness, and an increased risk of fainting. These symptoms can strike suddenly, especially when standing up or changing positions quickly, making falls much more likely. Moreover, dehydration affects the brain's ability to function properly. Mild dehydration can cause confusion, slower reaction times, and impaired cognitive processing, all of which contribute to poor balance and unsteady movement. If the brain cannot quickly process environmental cues or body position, seniors may misstep, stumble, or be unable to correct minor imbalances. Over time, chronic dehydration can also contribute to muscle cramping and general weakness, further undermining physical stability. Preventing dehydration requires conscious effort, especially since the natural thirst mechanism weakens with age. Seniors should be encouraged to drink water regularly, even if they don't feel thirsty. Foods with high water content like fruits and vegetables can also help maintain hydration. It's also important to monitor fluid intake during hot weather, illness, or when taking diuretics, which increase water loss. Staying well hydrated not only helps maintain balance but also supports overall health, cognitive function, and energy levels. 7. Arthritis and joint problems. Arthritis, affecting millions of seniors worldwide, is a significant contributor to balance problems after 60. Conditions like osteoarthritis or rheumatoid arthritis can cause joint pain, stiffness, swelling, and reduced range of motion. When joints, especially in the hips, knees, and ankles, are inflamed or damaged, it becomes harder to walk smoothly and maintain a steady posture. Painful joints can lead to limping or favoring one side of the body, which throws off alignment and increases the risk of falling. In addition to mechanical problems, arthritis affects the body's proprioception, the sense of joint position in space. Damaged or inflamed joints send weaker or distorted signals to the brain about their position and movement. This can cause seniors to misjudge their footing, overstep, or understep when moving around. Furthermore, fear of pain often leads seniors to move more cautiously or awkwardly, further impairing balance. Chronic joint discomfort can also discourage physical activity, leading to muscle weakness, reduced flexibility, and worsened balance over time. Managing arthritis effectively is crucial to maintaining balance. Treatment options include anti-inflammatory medications, physical therapy, and targeted exercises that build strength around affected joints without exacerbating pain. Assistive devices like braces, orthotic inserts, canes, or walkers can also redistribute weight and improve stability. Low-impact activities such as swimming, cycling, or Tai Chi help keep joints flexible and muscles strong without excessive strain. Proper arthritis management empowers seniors to move more confidently and maintain their independence longer. 8. Slower reflexes. Reflexes are the body's automatic responses to sudden stimuli, like pulling your hand away from something hot or regaining your footing after a stumble. As we age, these reflexes naturally slow down due to changes in the nervous system and reduced muscle responsiveness. After 60, even small delays in reaction time can be critical. A misstep that a younger person could quickly correct with a shift of weight or a grab for support may result in a fall for an older adult. The slowing of reflexes affects not just major movements but also micro-adjustments we constantly make to stay balanced while walking or standing. Tiny shifts in body position that require immediate responses become less efficient. This can make navigating uneven terrain, avoiding obstacles, or recovering from slight trips much harder. In crowded or dynamic environments, such as busy sidewalks or grocery stores, the ability to quickly react to changing situations is vital, and when it's impaired, the risk of falls escalates significantly. Improving or maintaining reflex speed isn't entirely out of reach. Engaging in balance exercises, agility drills, and strength training can help keep the neuromuscular system sharp. Activities that challenge coordination, like dance, pickleball, or martial arts adapted for seniors, can also enhance reflexes. Additionally, practicing quick stepping exercises or obstacle navigation can prepare the body to respond more rapidly when real-world balance challenges occur. Staying physically and mentally active remains the key to keeping reflexes as sharp as possible. 9. Cognitive decline. Cognitive decline can subtly but significantly impact balance in older adults. Conditions such as mild cognitive impairment, Alzheimer's disease, or other forms of dementia affect the brain's ability to process sensory information, plan movements, and react appropriately to environmental challenges. Seniors experiencing cognitive decline might forget to use assistive devices, misjudge distances, fail to recognize hazards, or become confused about where to place their feet, all of which can increase the likelihood of falls. Spatial awareness, our sense of how we move through space, is often impaired in cognitive disorders. Seniors might veer to one side while walking, bump into objects, or misstep over curbs or thresholds. Executive functions, like decision-making and problem-solving, are also compromised. This means that when faced with an unexpected challenge, like an uneven sidewalk or a slippery floor, seniors may be slower to adjust or may choose inappropriate responses. Anxiety and agitation, common in cognitive disorders, can further impair judgment and movement control. Early intervention and cognitive training can help maintain mental sharpness and indirectly support better balance. Programs that combine physical activity with cognitive challenges, like dancing, interactive games, or memory-enhancing exercises, can slow cognitive decline and improve movement control. In more advanced cases, ensuring that living spaces are simplified and hazard-free can prevent confusion-related falls. Support from caregivers, occupational therapists, and memory care specialists is vital in maintaining safety for seniors facing cognitive challenges. 10. Cardiovascular issues. Cardiovascular health plays a critical role in maintaining balance, yet it's often overlooked until problems arise. Conditions such as heart disease, arrhythmias, irregular heartbeats, and especially orthostatic hypotension, a sudden drop in blood pressure upon standing, can cause dizziness, lightheadedness, and fainting. When the heart struggles to pump enough blood to the brain, even temporarily, it leads to momentary confusion, weakness, and a feeling of unsteadiness. Seniors who experience these symptoms may find it hard to walk safely, react to obstacles, or even stand upright without assistance. In many cases, the symptoms are subtle and develop gradually. Seniors might feel just a little woozy when getting up too quickly or feel unusually fatigued after walking a short distance. However, these mild symptoms can quickly escalate. An unexpected fainting episode due to a sudden drop in blood pressure can lead to severe injuries from falls. Furthermore, conditions like atrial fibrillation can cause blood flow disruptions that not only affect balance but also increase the risk of strokes, another major contributor to sudden balance loss and mobility problems. Addressing cardiovascular health is vital for seniors concerned about balance. Routine checkups, monitoring blood pressure at home, and managing chronic conditions like hypertension or heart disease with medication and lifestyle changes are crucial steps. Staying physically active with heart-friendly activities like walking, swimming, or low-intensity cycling can strengthen the cardiovascular system and reduce symptoms. Seniors should also be cautious when transitioning from sitting to standing and should report any recurring dizziness or palpitations to their doctor promptly to prevent dangerous situations. 11. Changes in gait and posture. As the body ages, natural changes in gait, the way you walk, and posture occur, often contributing to balance issues. Seniors tend to take shorter, slower steps and may develop a wider stance to maintain stability. Hunching over, known as kyphosis, becomes more common due to spinal changes like osteoporosis or degenerative disc disease. These adjustments, though helpful at first, often lead to an unsteady walking pattern and a higher risk of stumbling, tripping, or losing footing on uneven surfaces. Gait changes may be subtle initially, a slight drag of one foot, less swinging of the arms, or a hesitation when stepping forward, but they are significant. Over time, these minor changes alter the body's center of gravity and disrupt the delicate balance required for smooth, coordinated movement. When posture deteriorates, the muscles in the back, hips, and legs weaken, further compromising stability. This combination of weaker muscles and altered mechanics forces seniors to rely more on visual cues for balance, which can be problematic in low light or crowded environments. Improving gait and posture requires targeted interventions. Physical therapy can teach seniors how to walk with better alignment and restore strength to key muscle groups. Simple exercises focusing on core strength, flexibility, and walking drills can dramatically enhance posture and stability. Tai Chi, yoga, and Pilates offer excellent methods to develop body awareness and core control, promoting a more natural and confident walking pattern. Investing time in correcting gait and posture can make a profound difference in balance and reduce fall risk significantly. 12. Lack of physical activity. Perhaps one of the most powerful yet preventable reasons for balance loss after 60 is simply a lack of physical activity. Sedentary lifestyles lead to muscle weakness, joint stiffness, poor cardiovascular health, and slower reflexes, all of which contribute to balance problems. Seniors who are inactive lose strength in key muscle groups like the core, hips, and legs, which are vital for maintaining stability during everyday movements. Without regular movement, even simple tasks like standing up from a chair or stepping over a curb can become dangerous challenges. Inactivity also affects neuromuscular coordination, which is the brain's ability to control body movements efficiently. When seniors don't regularly challenge their balance systems through activities like walking, stretching, or exercising, the neural pathways involved in stability begin to weaken. Over time, this leads to a vicious cycle. Fear of falling reduces activity levels, which in turn worsens balance and strength, further increasing fall risk. Psychological factors like depression and social isolation, often linked to inactivity, also play roles in diminishing balance and overall vitality. Reversing this trend requires intentional, consistent efforts. Seniors should aim for at least 150 minutes of moderate intensity activity per week, including balance-specific exercises like standing on one leg, heel-to-toe walking, or gentle yoga. Community fitness classes for seniors, walking groups, or aquatic exercise programs provide social benefits as well as physical ones. Starting small and building gradually helps seniors regain confidence, strength, and better control over their movements. Staying active is not just about fitness, it's the foundation for staying upright, independent, and thriving after 60.